Welcome. You've come to the Futures Festival to be inspired, to see, hear and read about what possibilities are out there to discover, and what the future may hold for education and learning in the perioperative environment. Before we commence, a quick introduction of myself. My name is Angela Waters and I've been a registered nurse for over 20 years. I'm a nurse first and foremost. However, I am also a perioperative nurse and nurse educator. This presentation will provide you with a brief overview of a framework for nursing education, a description of what is a perioperative nurse, comparison of the past and present nursing education environments, highlights of emerging technologies, and discussion of what challenges will be faced for implementing these, then a glimpse into the future. Before we look to the future, it's important to see what nursing education techniques have been utilised over time. Highlighted within the building blocks of lifelong learning, there were suggestions from Adker, Faulkner, Bucknell and Parker's literature review that nurses require broad-based clinical skills, need to acquire process knowledge rapidly, have ability to integrate new knowledge and existing knowledge to create new understanding, and have the need to be self-directed, seeking knowledge and be able to assist others. Underpinning all of these requirements, they also suggest nurses need to be involved in ongoing learning to develop the capacity to cope with the challenge of practicing in an ever-changing, technologically diverse healthcare environment. We have progressed in many education settings, from the blackboard lesson where the teacher writes on the board, to classes where students have a digital blackboard, where content can be distributed to the student digitally and learning can be more engaging to the participants. Mark Domcini, 2010, suggested a framework for perioperative education, stating online learning is both effective and efficient and particularly appropriate for adult learners compared with traditional lecture-style programs, and that if there is a conceptual framework that combines social constructivism, Benner's novice to expert theory, and the principles of adult learning, that within that framework it could potentially shift the quality of perioperative education to a higher level and result in safer, more reliable patient care. Perioperative nurses have extended their initial nursing skills into a specialty area that, as Smith suggests, requires competence, clinical skill, and experience. So, what is a perioperative nurse? Perioperative nurses provide care before, during, and after surgery or invasive procedures. They're pre-op nurses, post-op nurses, anaesthetic nurses, and intraoperative nurses. Throughout the 20th century, the perioperative nursing role evolved from a changing understanding of sterilising processes to advances in anaesthesia that has allowed for more longer, complex procedures to be performed. The following gallery of images of early nursing education in the early 1930s to 80s provides an intriguing glimpse to the past, where nurses were trained in hospitals with learning on the job while living in nurses' quarters. Students had opportunity to observe operations from theatres above the surgery being performed. New technologies began to develop that made operating that little bit more technical, like this early heart bypass machine. And excitement and fascination as the novelty of computers began entering into the clinical setting. From the 1970s to now, many changes started to occur. Computers entered the world, slowly at first, but now there is a rate of development of these technologies that is almost explosive, with changes occurring daily, new apps, ways to communicate, and new possibilities for education. Along with this is a new generation of nursing students that have grown up with the technologies as part of their lives. Nursing education was possible through both university as well as hospital settings, and from the early 1990s, all training was university-based. Hospitals needed to develop graduate programs to help integrate the university-trained nurses, and beginners needed more time to develop confidence in the clinical setting. Today, the periop nurse education in Australia involves the use of learning packages, an intensive week in a perioperative introductory program, all of which utilises education sessions and practical scenario sessions. As images from the internet may suggest, simulation-style training for nursing has been evident for decades. Technology advances have enabled simulation mannequins to be equipped with voice-over capabilities, digital chips, and robotics to enable the lifelike actions of breathing and heart rate. High-definition simulation and education events are delivered in clinical environments that can be observed and recorded, and then reviewed as part of the structured debrief that follows each scenario. Debrief sessions are designed to explore the participants' actions within the scenario and to discuss technical and non-technical points of interest. Mayer's from 2011 suggests that this can allow for learning and mistakes to occur with no major consequences to the safety of patients. Beyond current education, evaluation and feedback from PIP sessions always leaves me wondering what to do. So now we're going to look at some emerging technologies which may help us to address some of our education concerns. Firstly, let's look at augmented reality. When describing augmented reality or AR applications with colleagues and friends, the first question asked is usually been, what is augmented reality? The answer to this is simple. It's when there is an object that is not present in the real world, but appears to be because of a view showing a modified version of that reality. Next, I will show them what it is by either opening up an app or to demonstrate, or utilizing YouTube and companies like Augmentsys. The potential education benefits from this technology is in the orientation and training of staff into the perioperative environment, especially if the application like Augmentsys Ubik could be built to locate and describe equipment in the periop setting. Another AR innovation is from the company Blipper. Blipper states that their products will transform classrooms, lecture halls, museums, textbooks and workplaces into digitally interactive learning environments, encouraging students and learners of all ages to engage completely with their subjects by enriching teaching materials with immersive, unforgettable and uniquely collaborative experiences. If you already have a Blipper app, give it a try on my blog. Another evolution of augmented reality is through the app Dacry. Builds a 4D image over the printed media from the app. It then allows a person to view a representation of anatomical parts, thus providing a quick reference material for surgical procedures. This potential can also be utilized in simulation, and the technology of smart glasses will be able to be used in conjunction with it. Wikipedia describes smart glasses as a wearable computer that adds information onto reality. This is achieved through an optical head-mounted display, or OHMD.
Edward, talk to me, honey.
Oh, okay.
How are you feeling? Tell me how you're feeling.
We going dancing later, huh?
Folks, I just have a couple of questions for you, okay? My name is Brian. I just need a little bit more information, okay?
Okay.
Any other medical problems I need to be aware of other than high blood pressure and high cholesterol?
No, not that I know of.
No.
Are there any medications aside from lisinopril, simvastatin, and aspirin 81 that you're taking right now?
No. He just started slurring his words. I don't know what happened.
No, I'll be
It's going to be fine, folks. We're going to take care of you, okay?
I'll be all right.
Doctor, I'm sending over the patient's info right now. Our ETA is 2 minutes.
Okay. Yeah, I'm seeing his vitals now.
I'm coming to meet you.
Mr. Green, I'm Dr. Isaac. So, Mr. Green, I'm going to record a short video for our records, okay?
Yeah.
Record.
All right.
Mr. Green, would you raise your arms for me, please? That's it. Very good. Okay, send. Now, Mr. Green, we believe you may be experiencing a stroke.
Oh,
We're going to get an emergency CT scan right away, okay? Let's get him out of
I'm
it.
sorry. I'll be fine.
The patient is a 70-year-old male with a past medical history of hypertension and hyperlipidemia, presenting with 2 hours right side weakness and expressive aphasia. Patient denies neurological deficits and additional symptoms. Send a message to on-call neurologist. 70-year-old male on aspirin presenting with signs of left MCA occlusion for 2 hours, stroke scale of 7, hemodynamically stable. Requesting remote teleconsult ASAP. Do we administer TPA?
Call Dr. Isaac.
Hi, Julia. The CT scan just came in. Have you taken a look?
Taking a look now. I see no evidence of hemorrhage. Can we get the patient on video, please?
On my way. I'm sharing with you now. Mr. and Mrs. Green, I've brought in the neurologist for a teleconsult. Could you, Mr. Green, please show me your teeth?
Yeah.
Okay, now can you please close your eyes and raise your arms? Okay, now can you say, early bird gets the worm for me?
Any contraindications to TPA?
None.
Okay, I'm going to send you my recommendations right now. Let me know if you need anything else, okay?
Thank you, Julia. Mrs. Green, it could have been far worse. We caught it just in time, and we're going to continue to give him just the very best care that we can.
Thank you, Doctor.
You're welcome.
This video shows that Google Glasses allow seamless information transfer, especially suited to healthcare communication and processes, such as the benefits that we could use for collaborating with rural facilities and complex setups for procedures for the beginners. There are still some privacy concerns that will need to be further investigation. With AI technology and all these technologies, there will be challenges to be faced. Costs associated with these technologies, computer literacy of people using them, content development and how we can achieve that, infection control concerns regarding handheld mobile devices, and interference, will it still affect our life support machines? So many challenges. These AI technologies could be what is needed to update and reinvigorate how we provide education to our new perioperative staff. Consider how these technologies can deliver the necessary broad-based clinical skills. As new technologies are geared towards self-directed learning, we may need to instill these new pedagogies to the nursing learning curriculum to ensure staff satisfaction and clinical expertise are maintained in the new technology-filled world. As many of you are educators, I hope that you can take ideas from this presentation into your own fields and be inspired for what the future of education over the next 5 years may hold. Thank you for your time. If you have any further questions, you can post them to my blog, angelawatersblog.wordpress.com. Thank you.